So, this conversation is going to change the way you see depression. Depression isn't just sadness, it's often trauma in disguise. Today, we're diving into the trauma of depression and its hidden cause with Dr. Fred Schiffer. He's a Harvard psychiatrist, researcher at McLean Hospital, and founder of dual brain psychology. So, he discovered that trauma can get trapped in one side of the brain, which keeps us stuck in those old traumas and those old patterns of pain, while the other side holds the key to healing. Thank you to Dr. Bradley Nelson and iHeartRadio and to our audience. If you love what you're hearing, please do not forget to like and subscribe so we can continue producing this amazing stuff for you guys that'll help you change the way you live every day. So good to see you, Fred.
Hi, nice to see you.
Yes, what's going on in your world?
Well, I've been very busy writing a lot of papers and working on a book, and we have a huge study. It's an NIH study for the treatment of fentanyl addiction, and we're anticipating great results. So we don't have them yet. We're still blind, and we're going to finish that in 3 weeks, and so hopefully. You'll hear about that. Yeah. So
Yes, I'm
going on.
excited. And yeah, you're so busy all the time. You love your work and I love that so much. I find that just incredible.
I do, and love working with patients. Yeah.
Yes, I can tell. I can tell. So I want to get right into it. So most people see depression as a chemical imbalance. So
Right.
how is that incomplete?
Well, I think that the assumption is that depression comes from a chemical imbalance. Now there are chemicals in the brain, and whether they're imbalanced or not, and so forth, is a hypothesis. But but clearly, if someone's depressed, their brain state is going to be different than if they're not depressed.
Mhm.
And but the question is what comes first, and a lot of psychiatrists are of the opinion, and lot of people are that brain changes come first, and then you get depressed. And I feel that that's entirely wrong. That I feel that experience is is what causes depression, bad experiences, and
Mm.
and uh, and that bad experiences change the brain.
Right.
And
Yeah.
I just wrote a paper that's in submission. It's called the force of experience and it's about the way that experience affects the brain, changes the brain, and then comes back and and when it gets experienced, it then changes the brain again, and so the experience comes out of the brain, but it comes back to the brain, and but the point is that if you have a bad experience, it changes your brain chemistry and connections and so forth, and so one of the first things that I want to talk about with depression is sort of what is depression. And I don't like psychiatric diagnoses. Now it's clear that sometimes um, um, people feel hopeless and despondent and feel like they have no future, and that clearly is a depression. Uh,
Mhm.
so I'm not saying depression doesn't exist. Of course, it exists. In fact, it's the in the world, it's the major cause of disability of all illnesses, and so it's a major problem. But I want to define it just a little bit differently. In other words, that if someone is feeling hopeless and feeling like a failure, it's very painful. and that we associate depression with pain, and it is pain. But if you told me, that I was a failure, and you were angry with me, and so forth, it would hurt me. And if everybody was saying that to me, or if I were telling myself that over and over again, I would probably feel like a failure, and it would be extremely painful and would interfere with my functioning.
Yeah.
So, and then it would kind of sort of come true. So I wouldn't be able to go to work. I wouldn't be able to be a confident psychiatrist, and I'd go in and I'd be expecting everybody to be angry with me and say you're a
Yeah,
lousy
you would expect it because that's what you're used to. You know what I find interesting is I remember the bad so much. Like when something bad happens, I think this is true for everybody. You
Mhm.
remember a negative experience and it stays with you, but if something really positive happens, I find it fades so quickly.
Mhm.
Like I could win
Uh,
the lottery and I'd be like, "Oh my God, this is amazing." But then
yeah.
like an hour later, I'll forget about it. And but if a trauma happened, if I broke my leg, which would be painful, but I would remember and relive that over and over and over again.
Yeah, that's true. That's bad things uh, have what I would call salience. In other words, importance. In other words, I mean, it would be important if you won the lottery, and there are certain good things that will stay with you. Um, if you win the Nobel
That might have
Prize,
been an extreme example.
uh, but most of the bad experiences that we have a great importance to us, and that they're so painful that we remember them, and we stay on guard for them. We anticipate them, and we're
Hmm.
always looking for them. And so if something resembles the trauma, or resembles the insult to us, we kind of jump on it and take it in, and I say that experience is what's really important, what drives everything, and and um, and uh, and we take in experiences based on our prior experiences, and so um, if if you've had all good experiences and you've been very lucky, and I've had very bad experiences, and we both experience the same thing. Maybe there's a hurricane that's coming. Okay.
Hmm.
Now, because I've had very bad experiences, I'm going to be traumatized more by the hurricane than you are, even though
Right,
it's the same stimulus, because it's going to resonate with my prior experiences.
right.
And so that's why good psychiatrists always begin with, where were you born, and what was your childhood like, and
Right,
that's where the trauma usually starts, and then gets elaborated, and people forget that and don't understand um, that they've been traumatized and made to feel inadequate, and then that inadequacy interferes with functioning and gets elaborated as life goes on, and then when they're um, out of college, and they can't get a job, and they have to go back and live with their parents, and they go to the basement and play video games, and it just reinforces their sense of failure, and leads to a severe depression, and or if they get into drugs, the drugs causes depression. So all of these things are really intertwined, whether it's anxiety. Anxiety is sort of the fear of something bad happening, not just
Hmm.
something bad, but the trauma recurring. But it's not recognized usually. In other words, so people think, "Oh, I'm an anxious person. I get panic attacks," and they don't see that it's connected to the trauma. Or person may feel that, oh, I'm depressed. I'm a depressive. I got depressed twice, and so it's a
Right.
cycle. You know, it's not a cycle. It's just it happened twice or four times or every month or it's continuous. And
Right.
because once you get into the depression, it's hard to get out of
Hmm.
because it undermines your functioning and and
Yeah.
and and that reinforces the idea that you're a failure, and that's so painful, and it becomes unbearable, and um, and makes people choose solutions that lead to further failure, whether it's a
Yeah.
drug abuse or gambling or and none of the solutions are good. Occasionally, someone will find a helpful solution. Maybe they'll find that they're a really great athlete, and that might help them escape. Or they might, by accident, find that they have mathematics. They have a genius in mathematics, and
Yeah.
and so a teacher might encourage them and rescue them. That may not completely take them out of the trauma, but they might be able to survive. Whereas most people fall a victim to their trauma, and you can drown in it. And it's very common for people to drown in depression, and with that comes anxiety. And one of the things that the person's anxious about is that they may get depressed again.
Yeah.
And
They're
because
anxious about being
depression,
depressed and depressed about being anxious.
right,
It's a
right. And
nasty
it's just
cycle.
so
Yeah.
painful. Yeah. And that we're afraid of pain because, and that's normal.
Well, I
Uh,
feel like people outsource their power to things like alcohol, drugs, nicotine, shopping, gambling, when they're not able to face it or they don't have the right tools in order to face it. And so that's like an easy solution to not feel. I feel like the population has a really hard time sitting and feeling.
well, it's hard. It's hard to feel, and it's hard to stay with the pain. And that's when I do therapy with patients. That's really, the roadblock, and to try and get someone to look at their pain. And so this brings me to my book behind you, and dual
Yes.
brain psychology, and so. Uh, uh, and it says goodbye anxiety, depression, addiction, and PTSD. And what dual brain psychology is about, it actually leads to a way to treat depression. And the thesis is that I have discovered at Harvard through my research, doing sophisticated studies, that the trauma seems to get lodged more in one brain or the other, and that each hemisphere, the left brain or the right brain, is a complete mind or a complete brain with a mind. And so we actually have two minds, and one of them happens to hold more of the trauma. And it's easy, turns out that it's easy to stimulate the the adult side that's healthy and feels confident, or the immature side, which is sort of like the inner child that's traumatized, and it's sort of what psychiatrists would call the unconscious, but it's not unconscious because that immature side becomes active and is the conscious person who's acting and feeling depressed and symptomatic and acting immaturely. that
Right.
they start drinking or uh, uh, engaging in promiscuous behavior, or they're desperate, and they're looking for something that might bring them pleasure. That's why all the things that we call addictions all involve some kind of pleasure, whether it's gambling
True.
or food or drugs. But we're looking
Although
for.
I was using nicotine before and it would make me anxious.
Mhm.
But something about it made me keep going back for more, which is was so strange to me because I'm like, I know that if I use nicotine, it's going to cause me to have a little bit of anxiety because it puts your body in a stress response when you use it. But I kept
Right.
going back for more. And so
Yes.
I can't explain that.
Well, sometimes we go back to our trauma. That
Mm,
A good example is women who have alcoholic, abusive fathers often seek men who are abusive and alcoholic,
right.
and they dedicate their attention to fixing them.
Yeah.
And often, I mean, this is just you know sort of making this up, but there people have written books about it, um, and if in my experience, that if they are able to fix the person and he's not abusive anymore, then they drop him, they lose interest in him, and they find another abusive person.
That's just so
Because
crazy, but it's true. Yes,
yeah,
it's
yeah,
true.
we're drawn to our trauma because we want to fix it. That if you've been traumatized by an abusive father, say, then if you have someone who's not abusive, what's the use?
Yeah,
It's
right.
sort of
Because then we can't fix our trauma.
yeah,
I get it.
exactly.
So the
Yeah,
more that we heal ourselves, we'll need different things.
that's right.
We
Right.
attract what we are.
Yeah, yeah, and that might be what was happening with the nicotine. That maybe it was, allowing you to feel some trauma or something. I'm not sure, or maybe nicotine had other benefits aside from uh, feeling agitated. Uh, Now, why don't we? I know that you respond to the lateral visual thing, and it's a
Yes.
simple technique for stimulating the mind of the left brain or the right brain. And in different people, the immature troubled side is in the left brain, and in some people, it's in the right brain. But for the person, it stays on that side. And so let's show people how we do that. So you cover one
Love
eye
to. Let's do it.
and half the other eye. Yeah. So
Okay.
you okay. And um, so uh, how depressed do you feel, say from 0 to 10, as you look out
Mm,
the left half of your left eye, which would stimulate
I
your
would
right
feel like
brain?
7 right now.
Uh-huh.
Yeah, I
Okay.
don't feel good. I
And
don't
can
feel
you
good at
just
all.
and can you describe that depression, what that feels like?
I feel sick to my stomach. I feel tired, um, almost like emotional, like I could cry. Um, yeah, I just feel uneasy, like uncomfortable in my body.
And how do you feel about um, how hopeful are you, say from 0 to 10 right now?
Oh God, about a 3.
Uh-huh.
I'm a
And
very positive person, so it's a 3 is good. 3 is good right now, that considering how I feel.
yeah, but by three you mean not hopeful.
Not very hopeful. No,
Yeah, yeah. And so this is a very painful condition,
very
right?
painful. Yeah, I would
Yeah,
not want to live like this.
and so if this is all you know, which for a lot of people, they only know their troubled side, that you're desperate to get relief.
And yeah, oh my God, I would totally have a cigarette right now or an alcohol
Right,
beverage or something.
right, right.
Like I feel
And
susceptible to like negativity in this state. Like if someone told me I did a good job, I wouldn't believe them.
right, right. So let's try and stimulate your left brain and have you look out the right hand.
Gladly.
Your right.
Let's move right beyond that.
Okay.
All right.
So, so what are you experiencing?
I feel like I'm laying on a beach and I'm like super chill and nothing could bother me.
Uh, and um, and how does that feel?
I feel so good. I feel amazing. Like I could do anything. Like I'm proud of myself.
Yeah.
I feel like a 10 out of like 10 out of 10 enjoy, just grateful for
And
just breathing.
yeah, and so what I like to do as a therapist, if I'm doing dual brain psychotherapy, is try to get you to talk to the other side
Mm,
and show it that that there's a part of you that's confident that can do it and can succeed and
yeah.
and and so your job is to sort of be a co-therapist and
Mm,
try to help that little girl over there.
mm-hmm.
And as you succeed in teaching her that she is lovable and valuable, uh, uh, and that she has a good partner in you, that uh, you can actually uh, resolve her depression. Now, it's not simple because she's going to fight it. She's going to say, uh, uh, um, I, I, she's been in control for a long time and she doesn't want to give up control. And it's hard for her to believe that she could feel good. But the interesting thing is that on both sides, you're having an experience, an experience,
Completely 100% different experience.
yeah,
Like
a different experience.
unbelievably different experience. And I just want to reiterate to the audience that the very first time you and I did this together, you helped me understand that the little girl in me was in charge. And you asked me what she was doing. And I visualized her driving my van, essentially. And so the little girl, the 3-year-old little girl was in the driver's seat. And that's not good. So you helped me understand that. And now she's sitting in the back seat of my van and she's buckled in and she's happy and she's smiling. And
Uh-huh,
now I can see when she's troubled. She gets up and I gently tell her she's okay. And she sits back down. I give her a lollipop and I'm able to use my adult in me to
right.
drive the van. She hasn't been in the driver's seat since. So that's
Uh-huh.
been really positive.
Wonderful. Yeah, yeah. Uh-huh. And are you feeling better?
Yes, yes, 100%. Yes, because
Uh,
we were working through some stuff on live. You guys, if you haven't checked it out, go back and listen to those previous episodes. Um, because what you had discovered is that I had some trauma from my childhood dealing with
mhm.
my father and stuff that I had went through that I hadn't faced or dealt with that was still driving my choices today and causing that pain.
Right.
And we did that by accessing both sides of my brain.
Yeah. Yeah. And we're talking to two people in one person. And
Yeah.
and and uh and the other thing is that if I were to say to you, I think you're a valuable person and I think you're talented, which might be true, that the little girl's not going to believe me. Okay. But if you have an experience where she can read your mind, so when you feel confident and valuable, uh, she can see that. And so you can't lie to her. She could say to me, well, I'm getting paid, or I tell everybody that, that they're nice or something.
Yeah.
And so I'm not believable, but experience is really key. So if you have a positive experience about yourself, that really means a lot. That's
Right.
believable. That you know it because you experience it, you feel it.
Right. So what you're saying is sometimes we say things out loud and we don't actually feel that way.
Right, right. That's
Mm.
why I think affirmations really aren't so effective. I'm getting better and better every day, but I don't necessarily really believe that. But with this eye blocking thing, it really changes your actual experience. You actually can feel confident. You can feel, oh no, I can handle this now.
Yeah. Yeah, absolutely. So when we feel trapped in depression, what do you think the brain is trying to protect us from?
Um, Well, I don't know that the brain is, in other words, you have a child who's been traumatized, who's trying to protect themselves,
Mm.
and they've been hurt, and so they're very active and they dominate because
Right.
they want to fix it, and they're very dogmatic that they feel like they know how to fix it. They really don't, and so um, so um, it's a child who's trying to fix it, but the child is not well informed. It's sort of like going to a quack doctor, and he says, "Oh, you've got cancer and you need to have an operation," and then you go to the Mass General Hospital and you see a good specialist, and he says, "No, that's not a cancer. You've got a lipoma, fat tissue, and we can cut it out." And and
Oh,
uh,
wow. That's
and
a dramatic difference.
yeah, yeah, and you want to know what the reality is,
Hmm.
the troubled mind really isn't in reality. It's living in the world of its trauma,
Hmm.
and now if someone is living in a traumatic place, like if you're in the front line in Ukraine, you are in a traumatic condition, and
Yeah.
so we want to help you. I mean, that's the truth is that you're in a dangerous place, and
Right.
um, but with most people that I see, their trauma is untrue. In other words, maybe they had a father who was demeaning,
Right.
or a mother. I have a lot of men patients whose mothers said, "Oh, you're a failure," and the kid was in diapers, and and he and saying
Yeah.
he's a failure, and and
Wow.
and and I'm seeing him in his 40s when he's had a failed life, and try and teach him that, well, his mother really didn't know what she was talking about. She had her
Yeah.
trauma, and that's not the reality. And it's if I'm able to teach that little boy in him that he is valuable, then he gets better. But
Yeah.
it's a hard thing to teach. But it's in some people it happens quickly. So some people get
Mm.
better quickly, and some people it's a lot of work, because when the trauma is severe, it's hard for that little person to believe that they could be valuable.
Right. Do you see progression and then regression a lot of times, or when you're working with someone, like what is the process like?
Um, I think it's usually progression with some minor regressions. I mean, people are different, and some people may have a major regression, but generally, um, I think people feel better after their first session, and will have the little boy or little girl will have their doubts and will react, but it's usually not a full blown um, regression, and so I think uh, for for a lot of people it's progressive, and I think they get better faster than I would have achieved before I had this theory and
Right.
application. Um, and then there are people who take uh, a long time, to get through to. And if they hang in with it, they'll get better.
Right. Yeah, just like anything. So, does the brain actually start to rewire itself in this process?
Uh, that is would be a hypothesis. We don't have a way of really looking at brain wiring. And I don't have studies to confirm that.
Hmm.
Uh, but yeah, I think that the brain changes with experience,
Right.
and uh, and again with severe uh, uh, abusive experiences, it's harder to change the brain. Uh,
Hmm.
but but uh, if it's a successful treatment, yeah, I think the brain is changed. Absolutely.
Nice. And what role does compassion or forgiveness play in balancing the two sides?
Um, I don't know that forgiveness has a role. I think uh, understanding has a role. In other words, understanding uh, that you're not a failure, and that you were lied to, uh,
Right.
and uh, and to be able to bear that, to be able to see that you were betrayed, and so I don't know that it's uh, I think you have to face that and bear it. I don't know if that's the same as forgiving or having gratitude about it. I think but I think knowing it and being able to sit with it, being able to sit with the knowledge that it was a betrayal and that you were unnecessarily mistreated and lied to. I think that that's hard to face and hard to bear. But so I think the thing you really want to do with it is not just forgive it, but to bear it, to carry it, and
Mm.
not uh, be hostile about it, but to bear it and to use that energy um, to promote yourself and promote the world and try and use it to do good. And so I see anger as sort of your army. And if you have a good army, it's defensive and constructive. If you have a chaotic army, then you have rage attacks and you go around hurting people unnecessarily. So I don't recommend.
Mm. Yeah. I feel like 100 people could read the same sentence and translate it differently depending on the level of trauma that they have trapped in their body, essentially.
Exactly. Right.
I know it's
And
hard, like even with text messaging or emailing. I've had people translate my messages in how they were feeling in that moment. I've had zero, like my message was plain and there was no ill intent, but this person was going through something and they They analyzed my message and took it in a negative way. And it was because that's the way they were feeling in that moment.
Right.
So what are some things that we can do to be gentle with ourselves and other people?
Um, well, I think this eye technique that we're showing it is very helpful. In other words, if on one side uh, you experience yourself as competent and powerful, and on the other side as insecure, that makes you think. I mean, uh, it's confusing,
It is
and
very
and
confusing. Yeah.
yeah, and
I'm
if,
gonna
and if,
read everything with my with my left side covered from now on because I just feel so good with the covered.
yeah, and um, and so um, we want to use that as a tool to teach the other side that he's not a failure or she's not a failure,
Hmm.
and that she is lovable and valuable, and that is what we need as human beings. We need to be appreciated and loved and
Mm.
and not treated with disrespect and contempt, and which if we've had a lot of abuse, we wind up attacking ourselves
Yeah.
and and intensifying the abuse.
Yeah, it makes it worse. So, how did you even discover this? Were you playing with an envelope one day and you're
Uh,
like,
now, um, I saw that my patients seemed to change their personality. They'd come in as an anxious, depressed person, and then they'd do well, and then they'd regress. And so I saw this as two different people in a sense, or two different personalities. And then I reread the split brain studies where they actually cut the connection between the left brain and the right brain. And I actually went out to California and did a study with that group.
okay,
And that when you do that, the two sides are two different people because it's actually
that's
the connection's been cut. And so one person wanted to smoke a cigarette and it would light it up, and his other hand would put the cigarette out. And there are all these
wow.
stories about how the two minds disengage. And then I thought that, well, that might be related to what I'm seeing. But I really couldn't do much with it until I read a study from Germany where there was a group that had this $1 million machine that could show a movie to one brain or the other. And it was hard to determine what they were doing. They were masking the computer screen and tracking the eyes. And then I realized that they were showing the movie with this machine to one lateral visual field or the other. And I figured on my budget, I could do that by going like this. And
Yeah.
so uh, I went
I'm
to
gonna
the
watch
office.
a movie like this. I'm gonna see what the difference is.
Uh, yeah, actually, you'll see a difference. And then if you switch on the other side, you'll see a difference. That's a good provocative test, actually. And So that's how I discovered it from this German group. And then when I didn't have any emotional response then. I did later, but uh, and I think I mentioned that my first patient that day was a Vietnam vet with PTSD, and he looked out one side just with his hands, and he got very upset, and he said, "That plant behind you looks like the jungle." So he was back in
Wow.
Vietnam, and he looked out the other side, and this is the first time I had tried it, and he said, "No, it's a nice looking plant," and so I knew
Wow.
what
That
I
must have
had.
blew your mind.
Yeah,
You're like, holy smokes, that must have changed everything.
It did. It did. And then I started using it in my practice. And then the fentanyl study that we're doing for NIH, we're using a light that we put over the forehead on the positive hemisphere. And we're finding, again, we don't have the results from this study, but we see a lot of fentanyl addicts doing very well and
So what do
feeling
you
well.
mean by a light? Like a light?
Yeah, it's a special light that we developed. It sort of looks. This is a camera lens, so it looks like this, and we put it on the positive hemisphere. So with
Okay.
you, the positive hemisphere would be the left side. So
Yeah.
we put the light on the other side, and because the eyes cross over to the other hemisphere, whereas the light goes straight back. And
Okay. Yeah, because
so
my positive side is this side. When I look out the right side.
yeah, so that means your left hemisphere is positive.
Oh, okay. Gotcha.
And so
That
we
makes
put
sense
the
because they cross. Yes.
that's
So
right.
I would put
Just
it
like
here.
yeah, that's right. So if a person has a stroke on their left brain, then their right side of their body gets paralyzed.
Right.
So most of the brain crosses over, and with the eyes, if you look out the whole eye, it goes to both sides, and that's why
Mm.
you have to cover half the eye and look out the lateral visual field. Uh, but it very powerfully stimulates the opposite brain, and we have an fMRI study which measures blood flow. And we had people in the scanner just wearing goggles that permitted light to come in only one field or the other. If they looked to the left, they could only see out the left lateral visual field. And then they looked out the other side. It sort of had a cross in the middle. And there was a dramatic change in blood flow in the expected hemisphere. So if you look to the right, your left brain lit up. Uh,
Okay.
and so we know that it does, that this simple technique that works in seconds actually does affect the brain. And experience comes out of brain information. So you don't experience what's in my brain. So I might be, thinking about a trip to New York City or something, and you have no idea because you can't read my brain information. But your experiences come out of your brain information, and
Mm.
so all of your experiences. So if you have the trauma built into your brain, your experiences are going to be about the trauma. And that's why we can easily stimulate uh, negative thoughts when you look out your left side
You're
because they're
saying
built
my
in.
day-to-day experiences are going to be reliving that trauma, like just the simple things,
If you let that side dominate. But you're practicing to talk to the little girl and get to know her, and
right?
she's listening to you and cooperating with you. And so, for our uh, uh, demonstration here, you're allowing her to come out and express
Yeah,
her deep feelings, but you're able in your ordinary life to let your mature side dominate now,
yeah.
and so there may have been a time in the past where she dominated.
She
Um,
dominated this morning when I was stuck in traffic a little bit. I was starting to get
um,
agitated. So
mhm, uh-huh,
I think a lot of people can relate to that.
yeah.
Um, Being stuck in traffic, dealing with difficult people. She seems to get up and try and dominate at those times.
Yeah, and that's an interesting thing. That these two minds are like two different people, and and they each want to dominate, and just like
Mm,
two people, and and they often before they come into treatment, the two sides are often trying to kill each other,
yeah.
and
Well,
I try and
well,
get
for
them.
me, it was like the little girl got out of her car seat and I was frustrated. And so I said, sit back down. And then I felt bad after. And I said, oh my gosh, I'm so sorry. And then I gave her a teddy bear and I told her that I loved her. So it's like internal parenting. It's like teaching me how to
Yeah,
be compassionate and
right,
self-loving
right.
and understand my worth in those ways. But I yelled at her. I yelled at her
Yeah,
because
but
she was getting up.
sometimes you have to. If your child runs in the street, you
That's
have to yell.
true.
Yeah,
Yes, I said, sit down right now. You're
yeah,
not in charge.
right, right, and that's good parenting. Not to be, abusive and
I didn't
demeaning, but
throw her. I just asked her to sit down.
yeah, yeah, and with force. So
hmm
you get in the back, and
Yeah,
and so it's loving, but it's structure, and
right.
it's
There was no ill intent. It wasn't just to dominate her. It wasn't to take control. It was because she needed to get in the back seat.
exactly right, right,
Mm.
and it doesn't do her good to lead, okay, because she's only
No,
going to lead to trouble.
no, because she's going to crash the van.
Yeah, 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 and that
She's going
doesn't
to
do
drive
anybody any
over
good.
everybody.
Yeah,
A 3-year-old doesn't know how to drive.
exactly.
And
She
it's
has no.
crazy because a lot of people's 3-year-old inner child is taking control.
Exactly. It's very common. And
Yeah,
that's uh, I don't know what the statistics are, but it's probably a majority of people, who are run by their troubled trauma side
yeah,
because, um, trauma is prevalent. You know, uh,
yes.
everybody has
You
some
can
trauma.
see it in people when they're having like a little bit of a meltdown. They almost look like a child having a temper tantrum or a
Yeah,
tantrum.
exactly.
The
Right.
way they move their arms and just their facial expressions and what they say. It reminds me of a child.
Yeah, and with Freud talked about the id and the ego, and
Mm,
so the ego was mature and the id was immature, but the id was supposed to be unconscious, and and
okay.
so and so what I'm saying is that the id is actually conscious, and sometimes it dominates your life, and you're an active id, and
Right.
and
Wow.
and 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 that's not doing your id any good. Your id may want to dominate, but it's not going to get far.
Yeah.
And they want your ego, your strong, mature side, to be the leader and the parent and the therapist and the
Yeah.
co-therapist.
Well, this whole entire dual brain psychology has been life-changing for me in a very short period of time. Where can people find out more information about you and where can they get more information?
Uh, I think probably the best place is uh, on my website. I have a website called dualbrainpsychology.com. There's no punctuation.
Okay.
DUALBRAIN psychology.com. And you can order the book from that page. So the book it gives a lot of um, information to fill this out more. And have you started to read the book at all?
Yes, I've
And
dove into the first couple chapters, and it
uh
definitely teaches you how to speak to both sides of your brain.
hmm and do you find it interesting
It's incredibly interesting. Yeah, it
uh
makes a lot of sense. I wish I would have read this 10 years ago when I was going through my addiction, like when I was getting sober, because it would have
hmm
helped me understand that like it wasn't me. It was, and then I would have been able to talk to the trauma.
Right, right,
Yeah, seeing it as something separate from myself.
right. Well, it's a part of you, but it's a troubled part of you, and
Exactly.
and it needs to be attended to. And it's
Yes.
all mixed. It's that there's anxiety and depression, and it leads to addiction. That you
Yeah.
don't get addicted for no reason. You get addicted to relieve the agony of feeling like a failure.
Yeah. Even if it's unconscious,
Yeah, I mean,
we,
you're not
or
aware of
yeah,
it. That's what's going on.
yeah. I believe this book would be incredibly helpful to anybody who struggles with even low level anxiety, low
Sure.
level depression.
Mhm.
Because I know for me, I mean, our hormones fluctuate during the month, and there's different days where I don't feel my best. And I've been using your technique to tap into what I'm actually feeling and getting to the bottom of it so that I can address it. And it's helping me feel better a lot quicker.
Right, right. And the other good thing about it is that when you stimulate the little girl, you can talk to her and see what you learn more about what the trauma is and what she's really upset about. And
Yeah.
and
And it's usually
um,
not what I think. So it's been interesting to discover.
uh cool.
Yeah. So thanks so much for being here and talking about depression and your amazing discovery. Like I'm just so fascinated by it. And like I said, it works so quickly for me
Yeah,
anyway. It works
it
so
does for
quickly. It works
everybody.
so well.
It's amazing. It works in seconds.
Okay. So have you ever had someone who wasn't responsive to it?
About 15% of my patients don't respond to the lateral vision, and some people respond more to the light treatment than the visual, and some people respond better to the visual than the light. The light seems to be more
Do you have any
powerful.
theory why that is? Do you have a theory why that is?
Um, well, I think the light is more powerful because you're putting
Okay.
photons. Their energy. Light is energy, and you're
Mm,
stimulating the brain very directly, and it's
okay.
safe. But you're so we're trying to stimulate the brain with a credit card or an envelope,
Yeah.
and and uh, and uh, it's amazing that it works this well. I mean, I would never have thought that it would have,
Yeah.
and that was a discovery when the patient said that plant looks like the jungle. I knew, I knew, he was seeing Vietnam in my office. I
Wow.
don't have a jungle in my office. I really
You
don't.
don't? That's just incredible. And it's just goes to show that sometimes the simple things work the best. We're always chasing these expensive fixes. But it doesn't matter really.
And
It
then
matters that it works.
I have glasses that I'm trying to get manufactured that stimulate. They do the same thing as the card, but you can wear them, and the ones we're making are going to look better. They're going to be actually stylish, and you can flip it over and put them on the other side, so you can talk to both sides if you want. And so they're made to stimulate to do the same kind of stimulation. And in my practice, I use this rather than the cards. I have a patient put
Okay.
these on, and they can see out and yet stimulate the hemisphere. And so I can talk to the little girl or the little boy, and then the adult side at will, and we can say, well, why don't we flip the glasses and talk to the other side, and we go back
Mm,
and forth in our discussion, and because we want to hear from the troubled side and talk with it, and and a lot of times I have to that I can't say to the inner child, you're a good person. because it'll just throw it back at me and say, well, you're stupid if you think that.
Right.
But I can say, do you feel like you're not worthwhile? Do you ever consider that you might be worthwhile? And so if you ask it in questions, it allows, and I don't know why this is exactly, but it allows the child mind to consider things and think about them. And then I can actually have a conversation. And
Wow.
you know, and sometimes I'll talk directly with the little boy, little girl, and so the patient's sitting there, two minds, and I'll say, "Wow, that was really hard. You know, have your mother scream at you like that, and what did that feel like?" Um, and um, and it gets very interesting, you know. And if someone were watching us, they would think we were crazy. Yeah, talking to two people in one person.
Story of my life. At 8:30 p.m. every night, I put my blinds down and I do my healing work. And honestly, people were watching me, they would send me to the psych ward.
but it's helpful.
They're seeing me with an envelope going back and forth,
Mm.
talking to myself. Yeah.
Yeah, but
But
actually,
jokes aside,
we
it
all
is a
have those.
powerful technique
You know, and I
and it
use it
really
too now.
works.
Yeah, I didn't respond to it for years, and then I was in a situation that was traumatic, and then from then on, I respond and I use it, and if I wake up in the middle of the night and Freddie's upset, and I'll go down and talk to him, and I can look out his side and talk to him about what he's
Mm,
feeling, and then I can look out the other side, and so I do this work too.
yeah, good. Well, thanks again for being here today. I look forward to further conversations and thank you for the work that you've produced. Like I said, it's been life-changing for me in a very short period of time.
Thank you. Thanks so much. My
Yes,
pleasure.
and to our audience, try dual brain psychology. Go to Fred's website, check it out, try it for yourself, buy his book. I've only been doing it for a very short period of time, but I'm honestly have had some life-changing things shift in my world, just understanding that we are two different people. We have two different brains. Until next time, take care, everyone.